Surgery has become much less invasive over the years, and one of the developments that made that possible is robotic surgery.
Joining us now is Dr. Kim Cox with Pocatello Women's Health Clinic with a look at the DaVinci Robotic surgery. Thank you so much for joining us. This to me is fascinating because I'm a robot person. I'm not saying that I'm a robot, but just the whole use of being, using technology and using, mechanics to help make people better. It's got to be a really, really cool thing.
It is a really cool thing. I saw this about 10 years ago at a conference. I never really thought we would have it here, but was completely intrigued. And so when the opportunity came to get a robot here, we fully and strongly supported it. And now actually gynecology does about 90% of the surgery on the robot at the hospital. Some done by urologists, and there are some other fields that are coming into it, but most of it's done by gynecology.
Now, from what I understand, laparoscopic surgery didn't work all that well for gynecological surgery, and now this robotics has gone kind of the next step, and it can do kind of more delicate surgery. Well,
actually, gynecologists started laparoscopy, and all of its initial applications were with laparoscopy. And laparoscopies served us really very well. But large uteruses, large tumors, were much more difficult to operate on with the traditional laparoscope because the instruments don't have the versatility. When you introduce the robot, and let's make sure that they understand, this isn't a
It's not Danger, Will Robinson, danger.
Exactly correct. No, this is a device that basically takes the laparoscope and laparoscopic instruments and attaches it to controls, and then the surgeon goes to a console and controls those instruments with much greater dexterity and accuracy and fine touch than he can with the laparoscope. So I can take a uterus that I would normally have to operate on through a big open incision, and I can achieve that surgery through the robot when I would not be able to do it with a laparoscope.
I understand we have some video of this. Now, what are the benefits of doing this? Why would someone want to have robotic surgery?
Well, we find that our patients do much better. Less blood loss, similar or shorter operating times, and again, in difficult surgeries, we can achieve them through the laparoscope, through the robot, whereas otherwise we would have to do them open through a big C-section type incision. That's the major benefit, is it makes it less invasive.
Quickly, what are some of the concerns about the DaVinci Robotic?
Well, it's really very safe. There are some specific things that we have to be cautious of with anesthesia and with positioning, but essentially the risks are very similar to the same surgery done laparoscopically. There have been, it's a new technique, it's finding its place, but we really think it's the future of surgery.
And just where the benefits just outweigh anything else.
I think so. I think our patients do much better. We're finding that they go home earlier, they return back to work earlier, they feel better, they have less pain.
Very
Fantastic.
Good. Dr. Kim Cox, thank you so much.
Thank you.
And when we come back, we'll have your answers to our question of the day.